Meet Anne. She is 68 and retired a few years ago after working as a paralegal. Anne, like many seniors, lives on a fixed income. Recently, Anne was diagnosed with cancer. When Anne was working, she received her drug coverage through her employer. Today, Anne gets her coverage through the Medicare Drug Benefit Program, known as Part D. The Part D program is administered by private insurance plans that negotiate with drug makers over the cost of medicines. These plans determine which drugs patients have access to and how much patient cost sharing there will be on each one. Cost sharing refers to expenses that must be paid out of pocket by patients like Anne. It includes deductibles, flat copays, and coinsurance, which usually is a percentage of the drug's price being paid by the patient. Unfortunately, in Medicare Part D, there is no limit to how much seniors can be forced to pay out of pocket in a given year. So how does this affect a patient like Anne? When Anne goes to pick up her first prescriptions of the year, she must meet her annual deductible. For most seniors enrolled in Medicare Part D, that's $415. After Anne meets her annual deductible, she's still responsible for 25% of her medication's costs. In this case, her medication's cost are her $4,280 list price minus her $415 deductible. That means Anne pays $966 for her coinsurance, which is based off the list price of her drugs, not the actual price paid by her insurer, which is often much lower. So in January, Anne must pay both her deductible and coinsurance. This means she has to pay $1,381 out of her own pocket for her medication. In February, Anne makes her monthly trip back to the pharmacy. Even though she met her deductible back in January, she still has to pay her coinsurance, which is 25% of her drug's list prices, in this case, $1,070. This means she has to pay another $1,070 out of pocket. But her out-of-pocket spending isn't over. When Anne goes to the pharmacy in March, she has reached the phase known as catastrophic coverage, where she is no longer required to pay 25% of the drug's price, but still must pay 5% in coinsurance. This comes to about $215 a month out of pocket for the next 10 months. Add it all up, and Anne will spend almost $5,000 this year for the medicine she needs. That's a lot of money, especially when you consider that today, half of all Medicare beneficiaries live on about $26,000 a year. For someone like Anne, having to spend nearly 1/5 of her income to pay a health plan for her medication is wrong. And Anne isn't alone. 1 million seniors face significant costs averaging $3,000 per year for their medicines, with 1 in 10 of these seniors spending $5,200 or more in out-of-pocket costs each year. While the program works extremely well for most seniors, at any point, these high costs could impact any one of the 43 million seniors enrolled in the program. Fortunately, Congress has the power to fix the Medicare Part D system. They can start by placing a reasonable cap on out-of-pocket costs. This simple step would provide financial relief to vulnerable seniors, make it more likely that seniors will purchase and take the medicines they need, and help rein in other costs within the Medicare system by keeping seniors out of the hospital and reducing doctor visits. Anne worked hard her whole life, and it's time the system worked for her and the millions of other seniors like her.